stories of neurodivergence, yet you can't find the ones that speak to your life. Utopia, the campaign, aims to platform the voices of neurodivergence across different communities and life circumstances, so we find the words to get the support we need. Join me, Samantha Hiew, Director of ADHD Girls, as I uncover hidden stories of neurodivergence that come from a few, but speak to so many parts of our lives. Hello, Erin. Thank you so much for accepting the invitation. Really lovely to have you here with me today on board of the Utopia campaign. Can I start by asking you to tell us your name and where you're based and what is your professional capacity and interest in ADHD and neurodivergence?
Sure. Samantha, first, thank you. It's an honor to be able to be with you on this. And I think the Utopia vision is awesome. So thank you for your work in doing it. I am Dr. Erin Dodini. I am a licensed marriage and family therapist, licensed clinical psychologist. I'm a father of 4 children who are amazing, intelligent, bright, talented. I've been married for coming up on 25 years, and I live in just outside of Washington, D.C., in Arlington, Virginia, and I own and manage and the founder of Dodini Behavioral Health in Arlington. And so I work with other amazing psychologists and counselors and therapists. And we do a little bit of everything in terms of the mental health world. We work with children, adolescents, adults, couples. We're dealing with depression and anxiety and relationship issues. And ADHD is a big part of what I do. In terms of adult ADHD assessment and treatment, coaching program. So it's becoming a bigger and bigger part of my life, both professionally and personally.
Thank you for the introduction. You really do so much. I can see that's the whole multidisciplinary, way of like supporting and treating people with ADHD and other mental health challenges. And also, through our conversations before this interview, we learned that your daughter, Sydney, was newly diagnosed with ADHD as a young adult. And through your work as a clinical psychologist with this special interest in ADHD, and you see so many families with neurodivergent kids, why is it that you didn't pick up that Sydney had ADHD until she went to college?
Yeah. So this is a terrible story. I am an ADHD expert, right? I test adults, adolescents for ADHD literally on a daily basis. But maybe this is a bit of a public service announcement, right? That this is hard to identify. Even in our own homes, sometimes the experts can't tell. And part of the reason for that is that ADHD is very complex, right? We often think about the core symptoms of hyperactivity, inattentiveness, impulsivity, but it really just scratches the surface of the way that ADHD can present. It can present very differently in men and in women. Across the lifespan, it can evolve and change. So the reason I didn't even think about it was Sydney is brilliant. She's very, very bright. She went to a very competitive high school, always had A's, worked very hard. And for the most part, we never heard any complaints. She just got her work done. And the biggest challenge that was going on in our home was whether her bedroom was clean or not. And, that drove her mother crazy. But it just never really entered my mind, despite the fact that I was seeing it all day, every day in other places. So the reality is we weren't seeing her in the quiet moments, right? And by quiet moments, I mean when we were all asleep and it's 2 a.m. and she's in her bedroom still studying. And for her, it was just normal, right? And for us, we're like, man, these teachers are brutal. How much homework can one teacher give? And we would applaud her for being such a hard worker and um, having so much stick-to-itiveness and persevering. And a lot of times there would be emotional stuff, right? I'm exhausted, I can't get it done. But she was always able to make it happen. When she left for college, now she's in a dorm room with other women who are in some cases taking the same classes, have the same assignments, and she can now see, oh, this is taking me 2, 3, 4 times as long. Uh, and her roommates are seeing her be a butterfly, in terms of the way she would do her work, her homework, her the way she organized herself. And they're the ones that actually said to her, you know what, we think you have ADHD.
Right.
So she came home after her first semester of college and said, Dad, I think I might have ADHD. My roommates all think I have ADHD. And I patted her on the head metaphorically and said, no, sweetie, you don't have ADHD. Because I'm very, very smart and I know these things, right? And she said, well, can we at least test me? And I said, sure, but it's going to come back negative. Much to my chagrin and also real sadness. She came back. We did a variety of different tests. We use one that I think is a really exceptional way of measuring the symptoms of ADHD. It gives us objective data. It's called the Qbtech. And so when I first looked at the data, my first instinct was something's wrong with the test, even though I'd been trusting this data for years. Right?
Mm-hmm.
But when I started talking with Sydney about her experience, when she started having language for her experience, right, being able to discern a little bit from what her reality was and having some subjective experience, seeing what others' experience was, it started to fall into place. Right? We started seeing the symptoms in context a little bit better. But without the objective data, without being able to see, literally how much she was moving, literally how much she was impulsive, literally how much she was being distracted with raw data and numbers, I don't know that I would have believed it.
Mm-hmm. Do you think that maybe the fact that she didn't exhibit, some of the more kind of classic presentations of ADHD, maybe more so in girls and women, such as emotional dysregulation.
Yeah.
Maybe that was the fact that you have always validated her challenges. Could that be one of the reasons? Because if you provide this scaffolding, all throughout her life as a child until she left home, when it was all on her own, then that's when it became harder. And we know transitions is a key point, in which ADHDers can manifest their symptoms more, and leaving home for university is only like one of the first ones, aren't they, in a person's life?
I mean, I absolutely think you're right, Samantha. I think there are demarcation points where our surroundings shift, and so our view of ourselves and our situation can shift and change, and so we have more awareness in those moments. I'm seeing it all over the place with people's response to the pandemic, right? They're now working in different environments entirely. How they work is very different, and all of a sudden they're saying, man, I think I have ADHD. And it's because they've had all these techniques, ways of the scaffolding that you say, to support themselves. And when some of that scaffolding starts to go away, all of a sudden they're left with a different perspective. And with Sydney, certainly there were emotional transitions, right? Leaving home, she went to a university that was, on the other side of the United States, having a degree of independence that she hadn't had before. There were a lot of things going on that I think probably allowed us to start to see some of those symptoms a little more clearly.
So we were talking about emotional regulation piece, right? And as you say, that it's such a complex neurological condition, and I'm constantly surprised at how young people leave for university. Because that with children with ADHD, there is a known executive function delay, right? I mean, in the development of a prefrontal cortex, and like say we might be 3 years, 2 to 3 years or more behind peers of our age.
Yeah.
So like I think when I left for university, but that's a postgraduate at the age of 23, my mentality was probably like still 19 or 20 in terms of my worldview. So for people to leave at the age of 18, their mind was still like, way younger than their body.
Yeah, and I think with boys, we know that there's already a delay, right? And so we sometimes will see the boys' stuff more quickly, right? We'll see a disparity in terms of, gosh, you are acting much younger than your neurotypical peers, right?
Mm-hmm.
With girls and young women, it's not picked up as much, but yes, there is a delay. Sydney's going to hate hearing this, right? That as a 21-year-old young woman, she has the neurology of maybe an 18-year-old, um, yeah, I think that is the case.
So intelligence has nothing to do with executive functioning, and that's why she could still do really well in school. She just had to put on, some extra effort, to make it happen, which, no doubt comes with its own issues.
Yeah.
In your professional capacity of diagnosing and supporting families, with children with neurodivergent conditions and maybe ADHD as too, why do you think it's so hard, to tell when someone has ADHD, especially when you look at, like, say, families with diverse backgrounds? Could there, could it manifest in a different way?
In the US right now, we are talking a lot about anxiety and depression in youth, right? With a lot of the violence that gets perpetrated by youth, um, almost immediately it goes to what's their mental health, what's going on there, and depression is talked a lot about. And so I think as parents, we are maybe more attuned to, oh, that emotional volatility. Maybe that's anxiety, maybe that's depression. And I think there's more facility with language around those conditions. But anxiety and depression can look a lot like ADHD and vice versa. Right?
Mm-hmm.
So that's part of the complexity of getting the treatment. I could have said to you, yeah, Sydney's got some anxiety, and there are times when she's had some depressive episodes. And I would not have said, I think she also has ADHD, right? But certainly there was some interaction of those conditions going on. So the complexity is emotional, it's neurological, it's social, right? How folks with ADHD view themselves and the world can be very different. The rejection sensitivity dysphoria that doesn't get talked about nearly enough. Most folks don't even know that that's condition as part of the ADHD experience, and would be hard pressed to be able to tell you what it means, right? When you say, emotion or rejection sensitivity dysphoria, they're like, yeah, I don't know what that is. And maybe we would just say, well, they're just very sensitive people. But the reality is that it affects sense of self, and in some ways, sense of perception of reality, right? Social settings, and it affects all aspects of our relationships, right? Who we think of ourselves, who we make as friends, who we make as boyfriends or girlfriends, how we pick partners, all influenced by the complex interactions of the ADHD experience. And when you throw in some depression and anxiety and trauma in the mix, gosh, it is a complicated web.
We are looking into so many areas, and they're all interrelated, but then, within healthcare is so simplified and so kind of boxed in individual boxes. But then the reality is that it's so multidimensional, what people go through, and when you add sort of diversity within it, it can manifest in different ways. So from my own personal experience, parenting is a minefield. And when you add neurodivergence to it, it can be doubly hard. And I think that's more so also I'm dealing with my own challenges while parenting a child with similar challenges. And for you, what are the most difficult aspects of parenting a child with ADHD and potentially the co-occurrences?
Yeah. Recognizing the difference between normal neurological development, normal hormonal development, right? And understanding that some of that is just part of puberty or just growing up. We found it very, very helpful to have other friends who are going through the parenting experience with us, right? We were able to talk about some of their experiences and give a little bit of validation, but also some, hey, that sounds a little different than what we might be dealing with. So the challenges are that it often feels like we're alone as parents. We don't. Sometimes we're fearful to share our challenges with others, so we can get a little isolated. The emotional volatility, of raising teenagers and young adults, figuring out how to have the emotional intelligence, right? The ability to have some of these difficult conversations varies. And among our 4 children, they're very different personalities, very different strengths and weaknesses, and in effect, we're having to learn how to parent each child to their strengths and weaknesses, and that's challenging, right? Sometimes we want to just say, no, bedtime is 9 o'clock for everybody. It doesn't work so well when you've got somebody who's neurodivergent or can't shut their brain off at 9 o'clock. So the other siblings go, well, why does so and so get to stay up till such and such hour? And so managing just the diversity of children in general, and when you add on neurodivergence, it takes it to a whole nother level of complexity.
Do your children also get sensory processing difficulties, like or challenges?
Yeah, we didn't necessarily think about them in this context, but one of my sons is very sensitive to sounds. So he forever would complain about his brother who would chew with his mouth open, and it would just drive him crazy. And the rest of us at the table were like, we don't even hear him. Sometimes just touch, different kinds of touch feels more or less good, right? Some of those kinds of things we see some differences in. Frankly, some of the differences in tastes, what people like in terms of food preferences, whether it's the actual flavor or smell of things or the consistency. We see a lot of that as well as in families that folks that I work with.
So it would be really interested to find out, right? Because you have so many kids, like 4 children, all with different needs. And, I don't know their ages, but I suppose challenges are likely to be more apparent when they're a bit younger. Like you say, like if one child's chewing and the other person can't stand that sound, and it's magnified in their brain, it could cause some arguments and challenges between siblings and even within parents. Can I ask you, how does living in this kind of dynamic, how does it impact the family setting and the system, say between the siblings, the parents, and relationships in general?
Well, I think it can be quite dramatic. When Sydney left for college, the dynamic, first of all, we have 4 children. Sydney's the only girl, and then we have 3 boys. and the ages are Sydney's 21 and the youngest is 13. But the dynamic in the home changed dramatically. And we actually initially attributed to, oh, there's no more girls in the house, right? Mom has just gotten overwhelmed and overrun by all the boys. But I think, in fact, it was the degree of energy, right? The agitation that was often there, the sensitivity emotionally, as well as to sounds or to interactions. For Sydney, seeing her brothers do kind of boy stuff, wrestling and things like that, it affected her in a pretty profound way, right? She didn't like seeing sort of those kinds of conflicts. And so, yeah, it changes dynamics in some pretty significant ways that may be difficult to pinpoint why, right? For us, it was, oh, Sydney's left. Well, yes, she's left the house, but some of what she brought to the house because of her experiences with ADHD weren't as present in the home, right? Often the chaos that somebody with ADHD can feel inside themselves gets manifest externally, right? Mm-hmm. And so some of that chaos can happen in their bedrooms, and some of that chaos can happen in the family room, and some of that chaos can happen in some of the relationships, right? The tumult, volatility at times. So it's hard as a family therapist. You know, we think about systems. We think about how if one thing changes in the family system, it can affect the whole system, and it's true. And there are many things that are being tweaked and adjusted and changed in large families for sure, but families with neurodivergent children or parents, the number of aspects of the system that can be affected are quite significant.
Mm-hmm. Between the couple, because I think it's hard to carve out some time for yourself as well. I mean, apart from the time when you go to work, but that's not really relaxation time. When it's like so full on, it can be a challenge, to try and spend time together. And do you find like with helping, so many couples, because in your work as a marriage therapist and also in your own experience, do you find that there's anything in particular that you can do, to kind of make the relationship, or protect that relationship amidst all that chaos?
Yeah. Well, Samantha, you're wise in just recognizing that it can affect relationships, right? And marriages or partnerships. Children, by their nature, will divide and conquer, right? They'll go to one parent and ask for something, and if they get the no, then they'll go to the other parent, and so that happens in any family. But with the emotion involved, so I'll give you an example that I foreshadow a little bit. My wife really did not like it when Sydney's bedroom was, a mess. And Sydney would say, I'm going to clean my bedroom. And she would very purposefully and earnestly go in to clean her bedroom. And 8 hours later, there is something that has happened, but it is certainly not a clean bedroom. It's some degree of work. Well, that would really frustrate my wife. She would feel like she was lied to, right? You're being dishonest. It didn't affect me in the same way. I just closed her door. And so in many ways, I felt like I could be emotionally a little bit more available for Sydney than my wife could be, because my wife's feelings were hurt, or she was feeling frustrated and took some things personally, right? And that dynamic can get expanded, right? So that one parent becomes the go-to parent emotionally. And that can create all kinds of challenges. But the difficulty of parenting is so profound in general that couples don't do enough to protect their couple, right? They don't do the date nights. They don't have time to just sit and be together. And so that's something that I think most of the families that I work with, where we are talking about, okay, self-preservation stuff here, right? Self-care. How do you care for the couple and each of yourselves as independent beings as well?
Thanks. That's really insightful. Really interested actually in the last question for you is, as someone who's an expert and who now know, what it's like to be a parent of a child with ADHD, what is the best way to identify, to treat ADHD sooner and to support the parenting process that so many parents feel like they're left to themselves?
Yeah. Thank you for that question. I'm part of a consortium of ADHD experts. Really, I am the weak link in that consortium, but they've come out recently. We've recently posted sort of a call to action. What are the things that we need to be doing to more quickly identify ADHD and identify treatments necessary for ADHD? The data suggests that if we are able to identify ADHD before the age of 12, that those kids have far fewer accidents, their mortality rate is far lower, their incarceration rates are so much lower, substance use and abuse is so much lower. So there's a whole host of things that we can help children and young adults and adults avoid if we're able to identify this neurological condition sooner. The biggest factor is accessibility, right, to testing. And when I say testing, I mean objective data. For years and years and years, the use of subjective questionnaires and interviews was sort of the standard, and it's still a very important part of that process. But we needed objective data on which to be able to discern some of these symptoms. Physicians need that data, right, so that they can be comfortable prescribing medications that work for those who have ADHD. Yes, there are some challenges, abuse of some of the stimulants by folks who don't have ADHD. It's much more rare that somebody with ADHD would abuse the stimulant, right? It just affects our neurology differently. So I think the first piece is making sure that we have accessibility for kids and youth. We should be able to have standardized protocols for assessing this. We do this with all kinds of different things throughout the world, and ADHD is one of those things that I think we should be screening for. The best treatments involve a combination of things, right? It's making sure that there's medication available. It's making sure that there's coaching, psychoeducation, the therapy side of it, right? The psychotherapy component of it, where we can help folks with their sense of identity, their emotional volatility that may be involved with this, and helping folks learn how to be a little bit more compassionate for themselves. There's so much negative self-talk that goes along with ADHD. Why am I procrastinating? Why I can't get this done? I think so-and-so probably thinks I'm a ding-dong. There's a lot of the way that we treat ourselves that I think people like you and others who are putting out the education and helping people understand there's nothing wrong with you. You have a neurodivergency, and we can help you live more effectively in a neurotypical world, right? Let's be honest that most of the world doesn't care if we are neurodivergent, but we can figure out ways to use our strengths. There are a lot of strengths in folks who have neurodivergent abilities, right? How do we help them leverage those to be more effective in those areas? So being able to incorporate, the assessment, the treatment, and over the course of a lifespan too, right? The developmentally, the needs change over time.
So many parents feel like they're kind of left to themselves. There are parenting workshops, but like, is there any kind of like top tips that you would give parents to help them out?
Yeah, I mean, the isolation is a real deal, right? So if you are working with somebody, whether it's a coach or a therapist, a psychologist, inevitably they're going to have other clients, right? And so I do a tremendous amount of group psychotherapy in my practice. We do bring these families together. We do bring these couples together so that they, excuse me, aren't isolated. Finding, there are folks who specialize in sort of organization and structure and management of the life of a family, an ADHD family, right? And getting those kinds of resources, I think, are helpful. But my opinion is that the thing that's most helpful is helping us break through some of the stigma that comes with neurodivergence, that families, parents are willing to talk about it with each other and find a community. I love being part of building that community and helping bring people to the community that we've built.
What did you think of this episode? If it resonates with you, do share it so we can empower other neurodivergents too. We want to open up conversations for neurodivergence across all communities, especially the ones who are underrepresented, so they can get diagnosed and find the support they need in life and work. I'm Samantha Hiew, Director of ADHD Girls, and you can invite me to speak at your organization or subscribe to my upcoming bite-sized video courses on ADHD and neurodiversity via a new learning platform called Utopia. You can find a link via my link tree within my bio on Instagram and LinkedIn. Special thanks to Qbtech for being such a wonderful collaborator throughout phase 1 of this campaign.